Hi, it is September 23rd. I'm gonna vote. I don't know. I'm pretty sure it is. Anyway, my name is Casey. I'm doing a follow-up video to some other videos I posted about my experiences with recurrent autoimmune hives. I actually want to post a video about something not completely related to the science and study and treatment of our disease. I want to post this video about something that will be your answer to your disease, though, I think. And this is something that I've been wanting to talk about for a while now, and I go over and over and over again in my head about it, and how to put it, and how to present it, and how to talk to you about it, and what it is I can say that will get this across the most meaningfully to you. So let me try and make a go at it. I think it's very important that when you have a chronic disease, any chronic disease, anything that comes up over and over again, anything that's affecting your life in a negative way, that is frustrating you, that can't be tolerated, I think that there is, and you're doing this now by watching videos and educating yourself, I think there's a power and a responsibility of the patient or of the sufferer to do the research and try the options and see the doctors and see other doctors and see 10 doctors or 20 doctors, if that's what it takes, in order for you to become healed. I don't know if everyone out there is going to be helped by the thing that helped me, but I do know that if they're not motivated and not going to try something new or be willing to open themselves up to a new idea, that definitely is not going to help them. So here's my 2 cents worth. If you've gone to an allergist or a rheumatologist or an immunologist or an endocrinologist and that's not working for you, try something else. Try a different endocrinologist or a different allergist. Try them until you find someone who will help you. And when you go in, tell them what you expect. Tell them what is wrong with you. Tell them what you've tried. And if what they tell you doesn't make sense with what you're experiencing, go to someone else. Go and talk to people until someone listens, because eventually someone will. And if it's not a medical doctor, maybe it'll be a natural health doctor. Maybe it'll be a chiropractor. Maybe it will be an acupuncturist or an herbalist. I think anything is worth trying if it won't hurt you. I think when you start getting into treatments and sciences that have a high degree of risk, I think you need to be more cautious, but I don't think there's any harm in talking to a natural health physician, and that's exactly why I started talking to a natural health physician, and that's exactly how I found my answer. So that's my 2 cents worth. I don't think everything also has to be explained by science. I find some of the nomenclature pretty interesting that's going around online and in medical communities. Some people email me, or they post a comment, or they'll say, well, actually, I have autoimmune hives, just like you. And it's like, okay, great, that's cool. So we know it's got the same name, but it doesn't mean this necessarily the same thing is causing what's going on. The same thing if you have delayed pressure urticaria, it could very well be an autoimmune reaction. Or if you have, what is it? I think it's when you get it from the sun. I don't remember the technical name, but if you get too much sun, you can get urticaria as well. It's a lot of this is all part of the same process. I also get delayed pressure urticaria. I get hives whenever it tends to focus actually anywhere there's pressure, and also if I'm out in the sun too long. and I get slightly burned, causes inflammation, which also causes an aggravation of the urticaria. So because your hives have a different kind of name doesn't mean that, you know, that it's not actually part of the same thing or anything like that. So don't focus too heavily on the nomenclature, the names that the medical community prescribe to a condition, because if they don't know what causes it, then they certainly can't be sure of what exactly is the mechanism, can they? They just give it a name. Idiopathic means that they really have no idea what causes it. So keep your mind open, keep yourself motivated as best you can, and when you're unmotivated, come back and watch this video. Send me an email and I'll send you a rant about how if you've seen the same doctor for 5 years and it's not working, and you've done the same thing 10 times and it's not working, how maybe you should try something a little different. People can be very nice people and terrible doctors. And terrible doctors, or terrible people, can be very nice doctors. I've noticed that a few times. So that's what I want to instill in you today. If there's anything I can communicate, I want you to think of something that isn't working for you. Maybe it's not your health, maybe it's something else. Maybe one of the reasons you're not doing well health-wise is because maybe you're down in the dumps. Maybe you have some kind of depression, or something that's not working for you. Maybe you need to try something else. Maybe you should try some different depression remedies. And I'm not saying an antidepressant is going to be the answer for you. There's a lot of different things people try that help their depression. Sometimes it's just getting out in the sun. Sometimes it's exercise. Sometimes it's fish oil or St. John's wort. And sometimes it's an antidepressant. Frankly, with everything that people go through during these health crises, I think if you're not a little depressed, I want to know how you do it. So if it's overwhelming you, and that's what's holding you back from finding an answer, then maybe that's something to consider as well. So never stop asking questions, never give up because one doctor fails you. They're just people, and some of them make mistakes, a lot of them make mistakes, and quite frankly, there are very few really good doctors out there. That's my experience with it. So I am compiling the information that I talked about in previous videos, and I will be sending it out. And my best advice right now is that to keep researching, keep looking, keep asking questions, and keep trying new things till you find something that works. So that's it for today, and I will talk to you later. Bye.